Hi, my name is Morgan Stemmons. I'm a Wilson State practical nursing student, and today I'll be showing you how to perform a bed bath, oral care, denture care, and how to be changing an occupied bed. Now, before I can enter the room, I will need to look at my chart and see what I'll be going in and see if I have any restrictions or anything I need to be looking at before I go into the patient. Now, as I review the patient's chart, they are an unconscious female and they do not have any gag reflex or anything like that. So I'll perform hand hygiene and then I can enter the room. Hi, Polly. My name is Morgan. I'll be your student nurse today, okay? I'm just going to perform a bed bath. Now, my patient is unconscious, but if they are awake, I would have them verify their name of birth, or their date of birth and name. But today I will just be looking at their wristband. So we'll be verifying that. Okay, that matches my chart. And then I'll have that. So I'll just be placing my chart over here. And I'll just be explaining to Polly. So Polly, we're gonna start with a bed bath, okay? So for my bed bath, I will be removing this. So since this isn't soiled, I can set this next to but not close by so it doesn't touch the clean linens. But once that's on, now I can place the bath blanket on. Once the bath blanket on, Polly, I'll just have you tuck this in for me so I can pull the bottom. Then I'll be putting this in my linens. And once I have that, and I've gotten all my supplies ready, I filled my basins 2/3 full with about 105-degree water. I've tested it on the inside of my wrist, so I know it's okay. So I'll be grabbing one of my towels and placing it under Polly's head carefully. Okay, I'm making sure Polly is comfortable. And now, having this over here, and then I've got one basin with soap and one with water, and for the face I will only be using the water because I do not want to irritate Polly's skin because she might be sensitive and it might irritate it. So we'll be making a mitt. Okay, and then I'm gonna go inner over eye. And then rotating my glove, rinsing it off if it needs be, then doing her face, rinsing it off if need be, making sure to get her ear, her neck, rotating it, and then I'll be patting dry. So now I'll be taking off Polly's gown. And I've already done the farthest side away from Polly for video purposes, so I will only be showing this one side. And in this video, we didn't have a bath sign, but I would have put that up before I would have entered the room to ensure privacy for the patient. There we go. now I will be grabbing my soap. And I will be grabbing my towel and then only maybe helping the joint. Then I'll be putting my mitt on with my soap. And then I'll be washing Polly from proximal to distal, making sure to get in her axillary. And then I'd be applying deodorant after this too. So I'm gonna do my soap, then I would rinse, then I would pat dry, then I would help the joint and pull my towel out. Now after this, I'll be going to Polly's chest. Grabbing my soap. And I just will be giving her a good wipe. Then I'd be rinsing. Then I'm going to be doing my pat dry. And I would be going to her lower abdomen, grabbing my soap, rotating, rinsing if need be, and then I'd grab my rinse, and then I'd rinse her off, and then I'd pat dry. So after I've done her abdomen, then I would ensure privacy. Then I would come over to Polly and tell her, okay, Polly, I'm just gonna be cleaning your leg. So helping her joint, then I'd be setting it down and then grabbing my soapy water, making a mitt. Then I would be making a mitt, and then I'd help. And then I wouldn't be cleaning the feet yet, because I will do that right after this step. I'm gonna be rinsing if need be. And I'd be cleaning her whole entire leg, making sure to get all the way up close to the groin. And then I'd be rinsing and then patting dry. Patting dry. And then once I've done that, then I would move my towel down here. And if Polly was conscious, I'd ask her to bend her leg. But since she's not, I'll be helping her. And then I would take my soapy basin and I'd be placing her foot in it. Now, if she had diabetes or any impaired circulation, we would not be doing this, but I checked the orders and Polly is okay for me to be washing her feet. So we'll be washing it, making sure to get in between her toes. Her leg would be bent. And then once she has the soapy water, then I would use the rinse. And then I would be patting dry. And then we've done this whole side. So then I will be putting my towel in the linens. I'll be grabbing a new towel. And then I will be telling Polly we are going. Okay, Polly, so I'm gonna clean your back, okay? So I'm gonna have you roll over this way. Now, if Polly was conscious, she would do this for me, but for this video, I'm gonna just roll her over. And then I'm just getting her back. So, making a mitt. And then if you can see do this end. Okay, making a mitt, and then I'd be using my soap. Then I would rinse. Oh, I'd also put a blanket underneath Polly to support her backside and to pat dry. And I also, before this step, I would have changed my water after doing her feet. But, so I had my water changed, and then now I will be putting on gloves because I will be cleaning her rectal area. So I've put on my gloves, I've changed my water, and then, so if there was any fecal matter or anything of that, I would be grabbing that with a tissue, but Polly doesn't have any, so I'll be good. So then I'll be spreading her buttocks too, and I'll be wiping with soap, and then I'll be grabbing my rinse, and then I'll be patting her dry. And then after this step, I would also be changing my gloves and my water. And then now I can have Polly, we're gonna roll you back over, okay? Perfect. So now I'm grabbing my towel. I'm gonna place that under Polly. And then now we're gonna make our diamond shaped. So for this, be bending Polly's leg. I'll be taking this one, wrapping it around, ensuring privacy. Then I'd be putting this side rail up, just so I can come over here and do this leg. So then she'd be bending this one as well. I'd wrap it around. Okay, we'll do that a little bit later. And then it just has an opening for privacy right there. So then I'd be grabbing my mitt and my soapy water. And then I just ensure privacy and just make sure she's still covered. And then I would be lifting this up, and then I would be wiping down and then rotating my glove and making sure to clean, and then rinsing if need be, and then continue to clean and make sure. And then I'd be rinsing. And then I'd pat dry. And then once I'm done with that, then I can dispose of my towel. Then I can help her joints, pull them down, help her, and then pull her legs down. And then I'd be changing my gloves too after her prenatal care. So once that's done, then I will be getting ready for oral care. So I make sure to have her bib. Here you go, Polly. We're just going to be doing some oral care today, okay? And then the basin, and have another towel just in case any spills. And then I would be grabbing her dentures. I'd be grabbing her dentures nicely out of her mouth with a 4x4 gauze and then placing them in their cup. And then I would line the sink like I have them here. And then I'd be putting them in here. And then after I do oral care on Polly, then I will be cleaning her dentures. So right now, I have the cup, and this is just mouthwash diluted with water. And I get this and make sure to remove any excess. But first, I'll have Polly tilt her head as much as she can for me. And then I'll put this in one side. And then I'll be going in and getting her tongue and teeth. And then I would remove this and put it in the other side. And then I'd be getting a new one of these and cleaning this. And then once that's done, after I have anything, then I'd put this. And then I'd put water-soluble lip balm on Polly. So I'd get that on her. And now that she has that on and everything, she's good. So then make sure, and then I bring up her thing, take her bib off and towel, be disposing of that. And then I would be cleaning her dentures. Now for her dentures, I would be putting a little bit of toothpaste and using cold or like not warm water at all, because that would ruin the dentures and I wouldn't want to do that. So then I'll be brushing her dentures with the toothpaste, and I just make sure to clean these good. And then if Polly specified she wanted them back in, I would put them back in. We'll put them in here for now. So once we have these, so now I can move to making her occupied bed. So Polly, I'm just notifying you we're gonna make your bed, okay? So I'm gonna have you roll over again. So for this, I'm gonna ask Polly to roll over. So she'll roll over. And we're ensuring privacy still. Okay. And then I'm just gonna before I would do this, after I'm done with oral care, I would change my gloves as well. I'm going to roll this over as much as I can, and then I'm going to be grabbing a new fitted sheet and the chucks. I'm going to make sure there's no wrinkles or anything, because I don't want Polly to have any pressure sores and it cause irritation. And then I'm just going to be tucking this under the soiled linens, or unsoiled linens. Making sure underneath, try and get the no wrinkles. going to be placing this under. Okay, and then I would make sure it's all nice. And I'm putting my rails back up. And then I'd be saying, Charlie, we're gonna move you over, okay? So you're gonna be going the other direction this time. Make sure Charlie still was covered. Then putting linens, and then I would be grabbing the new fitted sheet. Putting it on, and I'll be grabbing this, unfolding it, and then I tell Charlie we're going to roll back over. So now that Charlie has her new fitted sheet on, now we will be putting the sheet on. Okay, and then I'll just be telling Charlie, I'm just gonna tuck this in you, okay, Charlie? Just so I can grab your back blanket. And now I'll be grabbing Charlie's back blanket. Okay, and then now that there's a new sheet on Charlie, I can put a gown on. So Charlie, we're gonna cover you up and we're gonna put you on a new gown, okay? It is his arm. And then earlier when I was giving Charlie cleaning his back, I would have gave him massages and lotion and checked for any back sores or anything. So now that Charlie has his gown on, we can put the top blanket on, which is fine because it was not soiled. then making sure his sheet is about 4 inches more than his top blanket. We'll be tucking this in. And then I'll be doing a mortared corner. Make sure everything's tucked in nice. Here, let's do that again. So it has a nice edge to it. I think there's some length over here, so it's throwing it off, but I will be doing it on this side. That there. As you can see, that did not turn out perfect, but I'm trying to get this corner here so no injuries. And I'm gonna untuck for his feet so there's no pressure. And then I'll also be combing Charlie's hair. So I'll do that. And then making sure his bed has no wrinkles. I don't want him, those aren't good. And then making sure he's comfortable. And then once I've made the bed, I would take out my linens and grab my supplies. I would ensure Charlie's still comfortable, and then I would document everything and perform hand hygiene. So, thank you. Oh, and then before I would leave, the last thing I will do is be changing Charlie's pillow. And I'll be helping Charlie's head. And then I would now throw my linens away. I would document my intervention. I would ask Charlie if he's comfortable, see if he wants the door open or not, and I would ensure privacy. Then I would do hand hygiene, and then I would leave. Thank you.